Hi everyone, my name is Ashley Mon. Thank you for joining me today. My speech is on the topic of holistic practitioners replacing primary care physicians. According to Jaslow of CBS News, in 2010 alone, the disabilities people lived the most years with were low back pain, major depressive disorders, neck pain, and anxiety disorders. The leading risk factors associated with illness and disease are listed as unhealthy eating, tobacco smoking, obesity, high blood pressure, high fasting glucose, physical inactivity, and alcohol drinking. Now, based on this information, the leading risk factors are all self-inflicted. It's because of this information that I hold firm to my belief and my position that holistic physicians and practitioners should replace primary care physicians in the U.S. Why can you trust me? My position is backed up on an extensive research and understanding of the principles of which holistic practitioners practice and the comparison of this to that of the common care physician. My first argument is that holistic physicians provide the most cost-effective treatment. This is because they practice preventative medicine. In these terms, they practice a medicine that prevents you from even gaining a symptom. So if you live a healthy lifestyle and your body is able to heal and defend on its own, you won't even acquire a symptom that will lead to an illness in terms which a doctor will just prevent or put a Band-Aid on. The American Holistic Medicine Associates says, holistic healthcare practitioners promote health, prevent illness, and help raise awareness of disease in our lives, rather than merely managing symptoms. The term disease that they use is not the word disease, rather it's the word dis-ease in our lives, referring to the stress that affects our body's ability to heal and prevent illness from itself. Holistic doctors have no incentive to press conventional medicine on their patients. In other terms, primary care physicians have an incentive to press their new medications and pharmaceuticals onto their patients, whereas holistic physicians would rather take an alternative route, and if that didn't work, then they would turn to conventional medicine. The AHMA also states that holistic healthcare practitioners embrace a lifetime of learning about all safe and effective options in diagnosis and treatment. These options come from a variety of transitions and are selected in order to best meet the unique needs of the patient. Now, I would like to cut the quote in half for a moment, just to put emphasis on the fact that they do state that it's on the unique needs of every patient. Holistic practitioners treat the person as a whole person and not just by their disease. Now, back to the quote, the realm of the choices may include lifestyle modification and complementary approaches, as well as conventional drugs and surgery. The American Board of Integrated Health declares integrative holistic physicians characteristically view symptoms in the context of an underlying problem. They attempt to treat this rather than use a pharmaceutical drug to band-aid the symptom. Holistic physicians are also very in tune with their patients, so they're aware of their lifestyles, their eating habits, and what their daily stresses are, which allows them to know the better functions of their body. It has been proven that there is a benefit medically in reducing, delaying, and even preventing disease when these changes to lifestyle are taken. In my personal experience with my physician, which in turn was my chiropractor, he kept in very close contact with me and was always very aware of the stressors or what I was up to and my physical activities. This allowed him to better know how my body was functioning rather than what the symptoms of my body were, how I was feeling one day or what was hurting. Rather than knowing that, he wanted to know what I was doing in my life that was causing that pain. From my own knowledge in psychology, the way that we think and feel and the stressors occurring in our lives affects the cycles of our body and the productions of hormones in our bodies, which affect our body's functions and ultimately its ability to heal. If doctors spend so much time and money to learn anatomy and biology, why would they oversee this and generalize drugs or generalize people by their disease? When your physician knows all of the antagonists to your health and they can understand how your individual body is working, they can better make the unique decision to help you, not your disease or your symptom, but they can make the decision that is best going to benefit you. Each individual's holistic practitioner works to build a relationship with you in order to help you live a lifestyle that will ultimately lead you to live a long, outstanding, and happy, healthy life. The argument that I have against my position is based off of the research that Steven Salzberg with the University of Maryland holds, where he believes that holistic and alternative integrative medicine completely opposes the true meaning behind medicine, and that it's a hoax and it's ineffective in the cure of disease. Now, the comment that Salzberg has is accurate in that a holistic medicine is not a cure for disease, but he is another example of those that lack the knowledge of what a holistic practitioner's principles are. Alternative medicine comes first as a form of prevention so that the individual does not even see symptoms. When illness is found or holistic alternative methods aren't met and they don't suit the needs of that individual person, then they will integrate conventional medicine. Now, the key word here is integrate. Though holistic practitioners do prefer alternative methods, they will do whatever is best for the individual, and if that means integrating surgery or drugs and pharmaceuticals, then they will do so. According to an unspecified author of the article Policy of Medicine, Dean Ornish is a physician researcher at the University of California, and he owns and founded his own independent preventive medicine research institute. Now, he's got about 3 decades of research that shows that diet, stress, exercise, and reduction of the above can do a better job of preventing, slowing, and even reversing heart disease better than drugs and pharmaceuticals can. Many doctors have claimed that after spending thousands of dollars and multiple years in school learning about our bodies and their functions, that they shouldn't have to take the time to learn the individual because they have the knowledge to generalize and assume what the disease or the problems are. And then in these cases, they write you a pharmaceutical or they prescribe you some sort of other method to clear the symptoms. Holistic medicine does not believe in this method. They would rather learn about you and what it is that's causing the symptom rather than why you have the disease. In their past experience of noting that lifestyle changes are needed, they note that the patient does not follow through with them. Now, it's also proven that doctors that have a better patient-practitioner relationship see more benefit and healthier lifestyle changes among their patients. Could it be the lack of time that doctors spend with their patients that keeps patients so unhealthy and keeps many people living with these self-inflicted illnesses? A statistic noted in Policy in Medicine states that 85% of new prescription drugs hitting the market are of little to no benefit of patients. I believe that this is either because they're overgeneralizing the pharmaceutical or they're overgeneralizing the disease. And rather looking in between the lines or more in depth, they hear you by your name, which to them is your disease, and they therefore prescribe you a drug, whereas holistic practitioners are going to take other routes first. Studies show that visits of primary care physicians average about 20 minutes, that in these 20 minutes, the doctors change the subject back to technical talk when patients mention their emotions, that they interrupt patients' initial statements after 23 seconds on average, that they spend a single minute providing information, and that they bring up weight issues with fewer than half of their overweight patients. Through my time researching all of these facts, that I have been able to find all of the practices of holistic medicine versus that of modern medicine, and in the time that I've been able to learn their principles and how they function, I believe that primary care physicians should be replaced with physicians that believe in patient-practitioner relationships and preventative alternative medicine. These physicians are what are referred to as holistic physicians. Thank you for your time, and I'm glad you all joined me today.